Hey everybody, welcome back to Life Under Deborah's Palm, the Dementia Road, where I have been missing for months now. Honestly, I just needed a break from the entire dementia thing after my mom died. It had been 10 or 12 years of nonstop care. But I still answer a ton of questions. I still have people who ask me a ton of questions, and today I thought I would hit one of the things that I found really frustrating, and I think people find frustrating, and it's one of the most asked questions I get. And it always has to do with the medical community, with doctors. What kind of doctor do I see? What are they doing? And just, there seems to be no continuity. Everybody has their opinion. Some people do great, some people don't do great, and I'd love to hear what happened to you and what worked best for you or worst for you in the comments below. But I think one of the first most annoying things about the medical community is that several of them have decided, I have to let my dog out, she's having a fit. One of the most exasperating things, I think, is that there are doctors out there that are telling people that it is totally normal aging to get dementia. That is 100% false. You can go look it up. You will find people who say that it is normal aging, but you will find there are neurologists that say it is absolutely not normal aging for your brain to do that. Age-related dementia is a myth. It just is, and they throw that term around a lot, and it's really not true, and it's very frustrating, I think, because you might be able to get help. You need a diagnosis of what type of dementia it is to understand if the medications can help you. So I'm going to go through a few things that I found on the internet that kind of compare normal aging forgetfulness to actual dementia. And of course, one of them is going to be forgetting something you were told. Normal aging is forgetting something you were told a long time ago. Dementia is forgetting something you were told very recently. That's why they forget appointments and that type of thing, because their short-term memory is really what's going. Another thing is the misplacing of items. So normal aging, probably normal for a lot of us, is setting something down, your keys, your phone, your glasses, whatever, and you're like, okay, where did those things go? But you have the ability to retrace your steps and know, I had my keys, I went here, I went there, they weren't in my purse, but I had a coat on, did I stick them in my coat pocket? You can retrace steps. Alzheimer's people, dementia people can't do that, and they usually will put them in an odd place. You've heard where they're in the refrigerator, the cupboard. My mother was frantic about a cell phone. I never found the cell phone until I cleaned out her house, and I found it in the bottom drawer nightstand that was my father's, that she would have no reason to use, and for some reason that's where it ended up. That's Alzheimer's or dementia, whatever form you end up. Dementia is the blanket for the forgetful diseases, and there's a multitude of them. So normal things that come with aging are things like technology or hooking up TVs or refrigerators or whatever you buy. You know, some of it's a technological change that just older people, don't necessarily follow the technology, and it's harder for them. Alzheimer's or dementia, some form of dementia, what happens is they can't learn the task. So if somebody just doesn't understand, like, hey, here's how you use your DVD, and you go, okay, you push these buttons, here's your remote, and it might take you a few times, and they're like, okay, I got it. With dementia, it's the inability to learn the new skill. Like they can't do it. No matter how many times you tell them, they can't do it, okay? That's dementia. When it comes to things like planning and decision making, somebody who gets older may have a little bit more, maybe a little bit slower. Like they just slow down at it. They got to think about it a little bit longer than usual. But someone with dementia gets very confused. They don't know, a lot of times because they don't know what day it is, and there's just a confusion in that. A common sign of aging is finding it hard to multitask. Like, you used to be able to do 100 things at once, and now maybe you can only do 2 things at once. Where someone with dementia often struggles to do one task. They start something and then they jump over here and they do something else and completely forget what they started. Another sign, and this is all about kind of decision making and things of that nature. Another sign of normal aging is sometimes you make a decision and you just didn't think it through well, and you probably should have thought it a little bit better. Somebody with dementia will make bad decisions. It can be impulsive and it can be bad. Like, they move their money, they throw their kids or whoever they picked for healthcare proxies and think they just all of a sudden they get crazy and they just think everybody's against them a lot of times, and they boot people off. As you get older, you might occasionally forget to pay a bill. But if you have dementia, that's common. Stuff goes like to the point of being terminated, you know, where maybe they want to shut off your power, or you didn't pay your insurance bill, and something, especially if it's a repetitive bill that you get every month. Okay, so common signs of normal aging is sometimes you can't find the word. People with dementia will refer to everything as like that thing or over there, or they will not be able to find the words. Normal signs of aging, sometimes it takes a little bit more concentration to pay attention to a conversation, but dementia people will find it hard to participate in the conversation, and a lot of times they'll just kind of zone out. Normal aging, sometimes you lose track if there's too many things going on. It's that multitasking thing. But if you have dementia, you'll have a hard time following the conversation with no distraction. I went through this with my mother. You would tell her something and then she'd go, okay, and you knew she didn't get it, and you'd have to do it and do it and do it, and then before the disease got really bad, it would click. All of a sudden she'd go, oh, yeah, I got it. That's not normal. As we get older, we might not know what day of the week it is, because truthfully, if you don't work and you don't have some place to be, that's not the most uncommon thing. With Alzheimer's or dementia, you lose track of days and seasons and time and night and day. Normal aging, you might get a little lost someplace that's not familiar to you, but with Alzheimer's, you will be lost in a place that is very familiar to you. I have said this before. I have a whole video on it about eyes, where common signs of aging can be cataract and cloudy type vision. But with Alzheimer's, they may start having a hard time interpreting what they see. So they see something, it's a reflection, it's a shadow, and they think it's something else. Okay, so I can go on. There's more stuff to it. But I think my biggest point is there's normal aging and there's dementia, and there is no such thing as age-related dementia, as the doctors like to call it. In other words, you got dementia or you don't. It is not normal aging. And if you find a doctor who tells you that, you might want to kind of go find another doctor who's willing to help get somebody diagnosed. Now, the diagnosis, I've said this before in other videos, I think it's age dependent. Our parents were all quite old, 80s, and it didn't matter. I knew what was wrong with my mother. I could guess what was wrong with the other two. I believe they all had vascular dementia, just from knowing their medical history and understanding a little bit. But if you're younger especially, you definitely want to get a diagnosis, and it is so hard to get the medical community to do something, and I'm going to continue that in another video because I don't make these videos super long. But I just wanted to hit you with some of that, the difference between there is normal aging. We slow down, follow an old person on the road, okay? They drive slow, their reaction time's slower, and if they know it, they compensate accordingly. Okay, that's not dementia necessarily, that is just getting old. Okay, so as I said, we'll talk some more about doctors and some of the frustrations of what I've heard, even some of the comments that have been left, people I've talked to, the stuff we've been through, and how difficult sometimes it can be to work within the medical community, and how little information they give you. So until next time, have a great day.